Welcome to our In Focus discussion tonight on Mental Health Awareness Week. NAMI Utah reports that in the past year, an average of 1 in 5 Utahns experience a mental health condition. And experts with the Utah Department of Health say our state consistently shows higher rates of self-reported lifetime depression than the national average at 23% versus 19%. Tonight, we will hear from people with lived experiences of mental health conditions and what's being done in the community to help bring these numbers down. Up first in our conversation is Gunnar Nielsen. He is a U.S. Army veteran and current executive assistant for Nomad Alliance. And Gunnar, thank you so much for joining us tonight.
Thank you for having me. Appreciate it.
Yeah. Gunnar, at your own comfort level, could you share whatever you're comfortable with about your mental health diagnosis?
Multiple things. I have ADHD, bipolar disorder, multiple personality syndrome, PTSD, and anxiety when it comes to being in crowds or whatnot. Loud noises will set me off into different time zone. You know, when I say that, it's like sends me back to places I don't like to be. So, you know, that with authoritative defiant disorder, you know, it's been kind of hard, but worked hard all my life to get all this under control. At times have not done so well at that, but.
And you know, I just want to thank you for being here, because I know just being here and having this conversation with us, like, that's not an easy thing to do. And so I want to say I appreciate you for being here in the first place and having this important conversation with us. I know a little bit about your background. Could you tell us about what you think some of the contributing factors may be that's led to where your mental health is today?
Started growing up, was raised in foster care in the state of California. Had 32 separate foster homes, not pleasant in, you know, any means. Got a hold of my birth certificate at a young age, forged my date of birth, went into the military. Spent time there doing things that I'll never be proud of, but it was something that had to be done at the time. You know, from that, you know, added to the trauma, everyday living in the streets. You know, people with mental health are looked down on, and we're like a plague. You know, just try to get rid of it. And instead of having more hospitals to deal with, you know, mental awareness, they just have more jails. You know, they build more jails. More than 2/3 of the inmate population have mental illness. You know, and law enforcement and the courts don't see that. You know, they need better trained.
We know that there's barriers, right? There's challenges, there's difficulties in getting access to mental health services. So Gunnar, right, how do you manage your mental health conditions? What has pushed you through? Where do you find support from?
What's helped me at times, I've self-medicated, using illicit drugs. You know, I will not lie. I have been using meth at times to help, but that was just a temporary thing. So I more concentrate on the everyday aspect of it. It's like I need to be aware all the time. You know, I worked hard all my life to do that, so I need to just focus on that more. And you know, the Nomad Alliance has really helped out a lot. It's helped me to contribute back to the people that, you know, I've kind of grown to call family. You know, you may not always like one of the family, but let somebody from the outside, you know, then it's all about, you know, stand up for everybody. And I've had 17 years of doing that. It's finally good to realize, I realized here a couple weeks ago that the reason I keep going away from homes and I mean, I've had houses, I've had apartments, and I've just walked away. And I came to a conclusion the other day that it's because I feel confined. And I don't like that feeling, so I'll walk away. And that contributes to a lot of, you know, my past history, being locked up several times for, you know, psychiatric evaluations or, you know, suicide watches, you know, just, but helping others, you know, has been such a blessing. I'm glad I can do it, and I hope to continue doing it for a long time to come.
Gunnar, it's incredible to see you here, see how far that you've come. I wish I had more time to pick your brain. I'm getting the cue to wrap. I want to give you 30 seconds to just say whatever you want to say, message to the viewers. What do you want them to know tonight when it comes to mental health?
To just be aware, you know, don't shun someone because they have a mental illness. You know, be aware, learn what you can. I mean, that's what I did at an early age. That's what's helped me. So just learn what you can, and instead of being a blind eye to it, see it and reach out a helping hand.
Well said. Folks, you've been hearing from Gunnar Nielsen, who is a U.S. Army veteran and now Executive Assistant for Nomad Alliance. Gunnar, thank you so much for being with us tonight.
Thank you.
We'll be right back. Thanks for staying with us for our second In Focus discussion tonight on Mental Health Awareness Week. Up next in our conversation is Fonda Bryant, a mental health and suicide prevention advocate who is also Nexstar Media's National Remarkable Woman of the Year. Fonda, thank you so much for joining us tonight, and welcome to the show.
Thank you so much for having me on this very, very important topic. I appreciate being here.
Fonda, at your own comfort level, could you tell us what some of your own lived experiences have been when it comes to mental health?
Oh man, well, you know, one of the things that people have to realize is that culture matters. And with me being Black, I was always raised to believe that mental health was a sign of weakness. You pray about it, you give it to God. We didn't talk about it. And that kind of mentality almost killed me 26 years ago when I had no idea I was dealing with, excuse me, clinical depression. And because of having clinical depression without a evaluation, I almost died by suicide. But thank goodness, my Aunt Kelly, I reached out to her, my hero, and told her she could have my shoes. And that's all of the conversation I remember. She called me back and asked me, was I going to kill myself? And I told her yes. And she went into action like a superhero and was able to save my life. If she hadn't, I wouldn't be here. So you have to take culture into account when you're dealing with mental health issues, because mental health is not one size fits all. Hispanic, Asian, Islanders, Samoans, Hispanic, we've all been taught that it's a sign of weakness, and we have got to change that mentality because it's killing us.
You bring up such a great point. Me being Asian American, I have dealt with the same thing. Mental health preservation and prevention just wasn't a thing growing up. And I resonate with everything that you just told us in that last answer. But I want to know now about the advocacy work that you're doing and how you're using your lived experiences to help others.
Well, you know, I walk in my truth every day. It is very important as an advocate that you be truthful with your mental health, because people look up to you. Once you share your story, whether you want to be an advocate or whether you want to be where people will come to you, that they do. And I take the role of being a mental health and suicide prevention advocate very seriously. And not only that, I heard Gunnar say the same thing. When you give of yourself, it makes you feel so much better, because you're helping people who were like you. And to be able to turn around and pull them up out of that quicksand and put them on the path of recovery is the best thing that you can do for your mental health. So I eat, breathe, and sleep mental health and suicide prevention every day, and I have helped so many people. My reward comes from helping people, and again, putting them on the path of mental wellness, because the thing is, we can recover, but we have to be willing to put in the work, and it is an ongoing journey, not a quick fix.
Well said. It's an uphill battle, but it is one that is so worth it. So I want to talk about the stigma around mental health. Gunnar talked a little bit about this. How important is language when it comes to communicating and discussing this topic?
You know, it's very important. Words can hurt, and they linger long after a physical a bruise would heal. And, you know, that's one of my biggest things is I get on people about using words like crazy, nuts, psycho, cray cray, bat crazy, manic, weirdo, loony. And people think it's no big deal to use those words. But just like you didn't know that I have a mental health condition, you have no idea who is around you, who is struggling. And when you use those words like, oh, they're just crazy, they're just nuts, that's nothing positive. And what's going to happen is that person might not go get the help that they need. They might not share with anyone. And those words can turn somebody into going down that path of suicide. So you have to watch what you say. You can't be an advocate and sit up and then in the same breath use words like crazy and nuts and psycho and think you're going to be able to help someone. You have to walk the walk, you have to talk the talk, and you have to walk the walk.
Well said. Fonda, now that we're talking about the challenges, the barriers, the language, what do you think that we need to do better as a community and society to improve mental health for those who are suffering?
Realize that mental health is real. It's a true physical condition. It's no different than diabetes or heart issues or hypertension. The brain is the most powerful organ in our bodies. It can get sick, but it can get better. So we need to realize that 1 out of 5 adults and 1 out of 5 children have a mental health condition. But the great thing is, if we put in the work, if we get professional help and we're willing to take ownership in our mental health, we can get better. A smile can hide a lot of pain. So I always tell people, treat people with empathy, compassion, and kindness, because you never know who is suffering in silence.
Well said. Fonda, if there is somebody who's watching this segment tonight, they're suffering, they feel alone, they don't know where to turn, maybe they're at their last wit's end, what's your message to them?
My message is very simple. You're not alone. There's help, there's hope, and there's recovery. Don't be ashamed to take the very first step. If you're suffering in silence, reach out to someone and talk to someone. Call the National Suicide Hotline or text, but get help, because I promise you, if you take that first step, you can get better and you can lead a good life. You're not alone.
You've been hearing from Fonda Bryant, a mental health and suicide prevention advocate who we can see and witness tonight why she is Nexstar Media's National Remarkable Woman of the Year. Fonda, thank you so much for joining us to share your story and insight tonight.
Thank you so much for having me. Appreciate it.
We'll be right back. Welcome to our third and final In Focus discussion tonight on Mental Health Awareness Week. Rounding out our conversation tonight is Kathy Bledsoe, who is the Assistant Director for Hope for Utah. And Kathy, thank you so much for making the trip to be here with us, and welcome to the show.
Thank you. Thank you for having me on.
Kathy, I'd like to get to know more about your organization. Tell me, what is Hope for Utah?
So Hope for Utah is a nonprofit suicide prevention organization. Our primary focus is spreading awareness about suicide prevention. We'll basically go anywhere in the state of Utah and train anybody, talk to any organization about suicide prevention, intervention, and postvention. And since starting our organization, it's a nonprofit, 501c3, many years ago, and traveling the state, we've trained over 60,000 people.
Oh, wow.
Our group of volunteers, we've trained a lot of people.
How long has your organization been around?
So we started working on suicide prevention way back in 1999. I worked in Provo School District. My boss, Greg Hudnall, worked in Provo School District. We were losing kids to suicide and knew that we needed to do something. So the first thing we did was organize our community. We started a task force, started hosting a statewide conference, but we were still losing kids. And we averaged about 1 suicide death a year. And then finally, Greg said, we need a peer program. And so we commissioned all of our school counselors, psychologists, our social workers. We worked with Wasatch Mental Health in Utah County, formed a committee, and this group spent a year looking at suicide prevention programs for schools across the country. And after a year of researching and meeting, we came up with our program called Hope Squads.
What prompted your interest and passion in this line of work for mental health, as well as with Hope for Utah?
So working in the school district, one of the very first suicides we experienced was a 4th grader. And every one of those suicides, losing those students, was very, very difficult. And after you go through something like that, you know you never want to do that again. And seeing the pain it causes a family and within the school system, how difficult it is to bounce back after losing a student to suicide, you just don't want to see that happen again.
It's a different kind of pain when you lose somebody you know to suicide.
It's the most difficult, I think.
I think so too, and it's preventable at the end of the day. Over the years, we've heard a lot in our communities about Hope Squads, and you mentioned them a little bit earlier. So what's the connection between Hope Squad and then Hope for Utah?
So Hope for Utah is like the umbrella for the program in Utah, and Hope Squad is the school-based program. It's a peer program where students in the school are nominated by their fellow students as being caring. They don't bully, they're good listeners, they're friendly. And these students are selected by the Hope Squad advisors and the school administration to become the Hope Squad. And the main objective of the squad is to increase inclusion and connectedness in the school. And they do that by learning about mental health. They do that by hosting programs, activities throughout the school, and just modeling that positive behavior that is so needed within the school system.
That's quite an honor, because these individuals who are part of the Hope Squad are individuals who have to be trusted, right?
Yes.
Those who
Yes.
can provide some sort of warmth that allows other people who may be struggling to be willing to come to them and open up and lean on them for support. That's amazing. So are Hope Squads just a Utah thing? Are they in other states? How many Hope Squads are there in schools?
Well, when we started the program in Provo School District, our goal was just to help our district. We were just trying to help kids and families in Provo. And as time went on, it started to spread in Utah. We're now in 35 states, over 1,100 Hope Squad members. And one thing that's really crucial about the program is that these students are empathic people. You know, they're seen as caring individuals, and they're taught that they are not the counselors, they are not the professionals, and that when a peer comes to them and shares a concern, that they need to hand that peer off to a trusted adult. That they need to recognize that they're a listening ear, but then they need to always turn to an adult for that assistance.
Now we know Hope Squads are growing and they're showing up in more and more communities, but maybe there's someone watching tonight who is not part of a community that has a Hope Squad yet. Do you have tips on how someone can support a loved one, a friend that they know may be suffering, or tips, what should they look out for? How can someone be proactive if they don't have those resources or support yet?
So anybody can be involved in mental health. Anybody can ask the question, are you thinking of hurting yourself? Being more direct, are you thinking of killing yourself? Anybody can do that. It's like your previous two guests talked about, breaking down the stigma and understanding that our brain is a part of our bodies, and that getting help for our brain is just the same as if you break an arm. And so we need to break down that stigma and start the conversation and be willing to ask people, are you okay? I'm worried about you. I've noticed that you're not acting the same, or something's bothering you. You need to show concern and use I statements and let people know that you're concerned. And the wonderful thing in Utah is that our Utah legislature is funding a Safe UT app. And this app is available to anyone. It's a free download in the App Store on any of your phones with with internet. And you can text, you can call. It's managed 24/7 by trained professionals. And it's just a wonderful resource, so that if somebody is struggling late at night and they don't feel like they have anybody to talk to, people will text before they talk. Adults and kids will do that. And so it's just an easy app to use and get help right away.
Yeah. Safe UT app, we know that it's worked. We just did a report that says we're seeing those reports come in and we're seeing those numbers go down.
Yeah.
All right. Thank you, Kathy. You've been hearing from Kathy Bledsoe. She is the Assistant Director, right, for Hope for Utah. And Kathy, thank you so much for being a part of this critical conversation. We appreciate your insight and your experiences and your tips and advice.
Thank you, Rosie. Thank you.
And don't forget, we would love to hear from you about the show. We invite you to join our Facebook group by searching for ABC4 In Focus, or you can send us an email at infocus@abc4.com. We'll be right back.